Welcome to episode 47 of the Cancer Pod. In this one, Leah and I talk about that why in the road, where you need to choose your cancer treatment path. Should it be conventional treatments, alternative therapies, and integration of both? Our inspiration for our chat is a film called The Cancer Conflict. Join us as we share our experiences and opinions on this crucial decision-making moment. I'm Dr. Tina Kaiser, and as Leah likes to say, I'm the sciencey one.
And I'm Dr. Leah Sherman, and I'm the Cancer Insider.
And we're two naturopathic doctors who practice integrative cancer care.
But we're not your doctors.
This is for education, entertainment, and informational purposes only.
Do not apply any of this information without first speaking to your doctor.
The views and opinions expressed on this podcast by the hosts and their guests are solely their own.
Welcome to the Cancer Pod. Hey, Tina.
Hi, Leah. We have kind of an interesting topic today. And we're going to launch off a movie that we saw called The Cancer Conflict.
Available on Apple TV and on Amazon Prime.
You and I just watched it, so it's fresh in our minds. And it's not about the movie. It's about what thoughts it spurred and the topics that we need to talk about, because this is important stuff.
I know. I kind of wish that we watched the movie together, because I kept pausing it and saying things to my husband like, wait a minute. So yeah, we got to figure out how to do that. I know there's ways people can watch movies across the country or from different households together. So yeah, we got to figure that out.
Well, Amazon Prime has a button called Watch Party.
Well, there you go.
Yeah, so I think it's that easy.
And I watched it on Apple TV, so we needed to have done a watch party. Yeah, because I think there were a lot of points for us to discuss, and so that's what today's episode is about. We're diving into alternative therapies, which we get a lot of questions from people about. Excuse me. So part of why we're going to talk about alternative medicine, how it differs from complementary medicine. And this movie interchanges them, which is just really hard to follow.
Yes. So the first thing is, what's the difference between alternative medicine and complementary medicine and integrative medicine?
So alternative medicine is what it says. It's in place of, like it's in the name.
Yes.
So let's say I don't want to take something for, let's say, my diabetes or my high blood pressure or whatever I've got going on. And I opt for a natural treatment, diet, lifestyle, whatever it may be. That's alternative medicine.
Because it's an alternative to the conventional treatment, whatever that is, usually a drug.
Right.
So you're using it in lieu of the conventional. So it's an alternative to that. And that is very different than complementary or integrative.
And I kind of think of those as the same. Complementary and integrative would be, again, hypothetically, I have diabetes and high blood pressure, whatever I've got going on. I'm taking my medications and I'm doing diet and lifestyle, and maybe I'm doing some other things to enhance the efficacy of what I'm taking as a medication, maybe so I don't take as high doses or whatever it may be, to manage side effects that can come about from those prescription medications.
Yeah.
And that's what we do in integrative oncology, is that we are making recommendations for things that support our patients so that they can get through their conventional treatment without any breaks as healthfully as possible.
Yeah. With integrative oncology, what we do is try to get people to make the right decisions, along the path. So I think we do help with decision making. Should I go left? Should I go right? Should I do X? Should I do Y? Maybe the third choice. Should I do Z? So we help folks decide also when to use conventional and integrate some natural medicines with that. Or maybe there is a time period where there's a long wait or they get a break.
Right. That 3-month period between scans, like what can you do?
Yeah. There's a lot of decision points along the way that I think people who are well trained in integrative oncology can really help people decide and make that decision properly and in their best interest, because the landscape is not only broad, it's deep of information. So the idea that, say, Dr. Google is going to have the answer and that someone who's not trained in medicine can find that answer in a timely manner, that's not going to happen, basically, comparing that to someone who just does integrative oncology for 10 years, 20 years, whatever, as a clinician, has seen thousands of patients and already has that landscape in their head.
Absolutely, right? The Facebook group of people who talk about alternative treatments. And I think that there are some good Facebook forums where patients talk about like, oh, well, this worked for me. Talk to your doctor about it. Like that's what they'll say is, well, when I had hot flashes, my doctor prescribed this or recommended this, but check and see if it's for you. There's a difference between that and this is going to work for you and conventional treatment isn't.
So the first tip off when you have cancer and you go to any professional, I don't care if they're conventional or alternative, if anyone tells you something works 100% of the time, be wary, because that's not commonly the case. I mean, nothing's going to work 100% of the time because cancer is not a monolithic thing. There's so many different cancers out there. But even within a given cancer, nothing works for everybody because we're all different and every cancer is a little different. So that's a big red flag when someone says, oh yeah, this always works, or I have 90+% success rate.
Yeah. And what I find interesting in the movie, they talked about, it was the filmmaker and one other guy, and they talked about how people got conventional treatment and also did complementary medicine. And they attributed their being cancer-free not with the conventional treatment, the surgery or, whatever it is that they did. They said it was because of the cannabis oil or whatever else that they took along with it. I found that to be a very interesting occurrence, which I have seen.
Me too. Yeah.
Where a patient will get standard of care treatment for something like a non-Hodgkin's lymphoma, say, which can be very, very treatable and curable using chemotherapy. And they will attribute there being no evidence of disease with whatever complementary medicine that they chose or complementary lifestyle choice. So let's rewind a little bit and we'll kind of just set up the movie. And like you said, this isn't really a movie review. We're just going to kind of bring up points because, yeah, there are a lot of times when I'm watching something or reading an article and I'm like, hey, Tina, what are your thoughts? And so this is going to be a Hey, Tina moment. Ooh, maybe that's what we'll call it. Hey, Tina.
Well, and this brings up the whole idea that, people will attribute, like you just said, the success of a treatment to the natural things that they did. I have seen this so many times that I always question it. When people tell me, oh, my neighbor had such and such and they cured it with natural means of some kind, I will always tell them to go back to their neighbor and ask them what they did conventionally as well. Because if there was an alternative medicine that was reliable, I'd be 100% in. I would be there, wherever it is in the world. I'm still open to it. I still would love to find that. I'm telling you, after 22 years, I haven't seen it reliably. I've had cases of regressions, amazing regression, people going all around the world, or even my own patients. But I can't say that they can be duplicated over and over again to a point that they can call it reliable. So,
well, let's take a quick break and then we'll come back and we'll kind of start talking about the movie and all of our questions that we had around it.
Sounds good.
Okay, we're back. We're back and we are going to use the movie The Cancer Conflict as a launching pad for us to talk about various alternative and complementary treatments.
Yeah, and really the only thing you need to know as a listener, assuming you haven't seen the movie, is that they take two people. There's a gentleman who is very scientifically minded and eventually brings in alternative medicine into his treatment. And then there is a female patient with breast cancer who, right out of the gates, doesn't want any treatment, including surgery for her breast cancer.
So, and to go a little deeper on that, Grant, who is the patient with colon cancer, he's diagnosed with what he thought was he was told he had stage 3 colon cancer. And then started experiencing some back pain. And then they did imaging and they realized, oh, we misdiagnosed you. You actually have stage 4 colon cancer. So he was diagnosed with terminal colon cancer. Surinder was diagnosed with, we don't really get a lot of information other than it's a grade 2. They said later on it was pea-sized, so most likely a pretty early stage invasive ductal carcinoma, but she doesn't opt for any treatment. She thought that, what were her words about the mastectomy? Mastectomies were barbaric and that they only treated the symptom, which I found to be an interesting conclusion that she came to, especially because she was diagnosed in 2012. So a lot of advances in surgery had happened, but that was her experience. And this was her choice to not treat it in any way conventionally.
And this harkens back to our interview with the retired breast surgeon,
Mary Barnhart,
a prior episode where we talked about this briefly. And, there's surgeons who have tracked this, and women who refuse surgery for early stage breast cancer do not have good outcomes. It progresses.
So were you yelling at your I wasn't quite yelling at my TV, but in my head, I was like, just get the surgery. Just get the surgery. Please get the surgery.
No, I thought to myself, I wonder how this movie is going to end and where along her trajectory it's going to end, because I know how it's going to end if she never gets any treatment.
And kind of skipping around, she does try to get imaging from, I think, a conventional oncologist. And this all takes place in England. So a lot of the treatments are different, especially with Grant, in terms of choices of medications or what's available. It is very different than what's available in the US. But so she tried to get somebody to follow her with just the imaging as she chose these alternative treatments. So she wasn't doing anything conventional. She just wanted to do these recommendations that she got from a naturopath wherever she lived. And then the doctor was like, no, we're not going to track you.
Mm-hmm.
We're not going to monitor you. So she ends up seeing a woman who does thermal imaging. What is it called? Thermography?
Yeah, thermography.
Yeah. And this woman herself says that she has managed her tumor naturally. She never had any treatment. She's like, my tumor's still here, still present, but I've been doing this all naturally. So she's followed by thermography, which the movie points out, and I know we've mentioned this before too, this is something that is typically done in conjunction with mammography. This is not something that is a standalone.
Mm-hmm.
People do it as a standalone or an alternative to mammography, but there's no evidence showing that it's accurate.
No, the problem with thermography, I wrote about thermography for the Natural Medicine Journal a long time ago, and basically nothing much has changed since.
We'll link to that. Let's put a link so people can read that.
Okay. So thermography is looking at the difference in temperature of the tissue. And it's not rigorous enough to differentiate inflammation from cancerous growth. Inflammation and tumors tend to be warm, but there's no studies that are rigorous enough to say where the parameters are, where the cutoffs are. So in this movie, that thermographer said things like, you are high risk right now. And then she comes back, gets a repeat thermogram, and she's like, now you're low risk, just like me. I have something that's not growing in my breast. And I'm thinking, what we don't know in that thermographer is, did she get it biopsied? Is it benign? She's just assuming any lump in her breast could be something else. We don't know. We don't know her story. Neither does the patient who's trusting her with her life. I had a lot of problems around that, including the fact that basically at that point, that thermographer is really, at least in the United States, would be really treading some seriously dangerous waters as far as medical advice goes and acting as a physician at that moment. You can't say that from a thermogram.
Yeah, because there was that point where her tumor went from pea-sized to 2 to 3 centimeters.
Mm-hmm.
And then she had the thermogram after that to kind of see what was going on.
And at that point, she already knew it was cancer. So it had already been biopsied when it was pea-sized. So my thought is this. Any tumor that grows from a pea to 2 or 3 centimeters needs to come out. I mean, if someone's going to do that, if someone's going to leave a tumor in place, and like she grew up, she's like, I haven't taken medicine in 30 years. She had no intention of ever getting conventional.
Her whole family, like none of them really believed in or went to conventional doctors, I should say. Her whole family was that way. She also said that she was told mastectomy would be her only option because she was so small-breasted. And so doing a lumpectomy, I guess that was kind of like my thought in terms of my having a mastectomy in place of getting a lumpectomy, was the fact that it would have been a shark bite out of my breast.
Right.
But yeah, there was no discussion of if there was going to be reconstruction or anything. She just did not want the mastectomy.
And I've met those folks who are philosophically opposed to conventional medicine, and that's her prerogative. And I can tell you what I have done with those folks is just let them know what I think is going to happen. I mean, I don't really mince words. And I would say if someone had biopsy-proven breast cancer and they came to my clinic and they were refusing surgery, I might see them for a couple visits, thinking that's how long it'll take to convince them to go ahead and get the surgery. And after that, I would say I can't ethically continue our relationship unless they have a medical oncologist as well. We all know what we're trying to do is get them definitive treatment. I'd love for her to be right and alternatives to work. You have to get surgery with breast cancer. That's it. End of story.
Well, she had such a different perspective even on the cancer itself. Mm-hmm. She saw cancer as a gift. And that is something I've heard from patients as well. And I always find that very interesting. And I kind of explore, what does that mean to you? So yeah, her whole attitude towards what was happening was just very different than I have seen patients experience. She did see this naturopath who told her that all breast cancer is caused by hormone imbalance. And I thought I heard them say excess estrogen. And so she needed to get these like hormone supplements. And she was taking like 32 different supplements a day. But yeah, the whole thing, again, I could be wrong. I didn't go back and rewatch it, but I thought she said it was caused by estrogen excess.
Yeah, I didn't catch that, but it very well might have been said. I caught the 32 supplements.
And the hormone imbalance part, right? Like all she had to do was balance her hormones and she would be fine.
Yeah, which is not true.
Yeah, so I am pausing this movie throughout and just turning to my husband and going like, okay, this is my thought on it.
Yeah, so maybe we should have a watch party. I actually bought the movie on Amazon Prime, so we could always do that and put it up on YouTube.
Oh, yeah. Yeah, we can once we figure out how to do a watch party. I know Christine McConnell does watch parties all the time. So we'll figure that out. And we can do that. That would be fun. So she did get that false sense of security. She went back to one of her doctors and they told her her lump was stable. And she was doing 32 supplements a day.
Was that her doctor? Or I thought that was a thermographer that told her it was stable.
That was earlier before she went back for that second thermogram.
Okay.
So that's kind of introducing Surinder. And then going back to Grant had surgery. So before he found out that he had stage 4 cancer, he actually had surgery for his colon cancer and was told he was cancer-free. And then has started experiencing the pain and was told that they missed the cancer that was in his bones, lungs, and lymph nodes.
Okay, let's talk about this. This is one of those things that I have seen way too many times. This is a weird anomaly within oncology. And I know these folks are in the UK and it's different than the United States, but wherever people are, and our listeners are around the world, so I don't care where you are, you make sure that they have the proper stage before going through with surgery in particular. So they diagnosed him with stage 3. What they missed were lesions in his bone and lung, possibly. There's no evidence that they actually did scans, and I've had too many patients never get a full body CT scan before they have surgery, and a major surgery like his. Taking out part of your colon, especially towards the rectal area, is a major surgery. Everyone should get staged. Everyone should get at least a CT, maybe a CT and a PET scan, so that you know for a fact what you think is stage 2 or stage 3 or even stage 1 is in fact that and not disseminated to another tissue in the body. The lung, the bones, the liver are the most common places that we're looking at. I've seen this so many times, and every time I see it, I cringe because it's tragic, because they go through a major operation just to find out afterwards that may have not been the course of treatment had they been properly staged.
Like we've said, we know the NCCN guidelines, or we know where to look them up for treatment here in the States, but we don't know how things are treated, especially with the medical system that they have over there. It seemed like a lot of these choices that were given to him, not a lot, but some of those choices he was given were based on cost. So you can't get this drug because it's expensive unless this happens. He had to jump through loopholes and he actually misrepresented information, which I thought was interesting too, because he goes to Germany to get what I guess is considered an alternative therapy because it's not offered in the UK, but he got TACE for the lesions in his liver. And that is something that is offered here in the US, but I guess it's not offered to patients in the UK. So
you should explain what TACE is.
Oh, it's putting chemotherapy directly into a tumor that's in your liver. But then the medication that he got, and I cannot say this name, aflibercept, it's typically with systemic chemotherapy, and it's a VEGF inhibitor, which is the same as Avastin or bevacizumab, which he had to kind of fight to get that. So it's really interesting that like, oh, Avastin's too expensive. We can't do that unless you jump through hoops or whatever. But they gave him this other drug, but I don't remember him getting the other chemo regimen that in the States patients typically get.
And even in that time frame, because this was 2013, 2014 that we're talking about when he got his treatments.
Yeah, I mean, FOLFOX, whatever he would have gotten some sort of 5-FU regimen, and he didn't. Yeah, it was really interesting. So he goes to Germany to get both the TACE plus I'm assuming what he got also was RFA. He talked about getting lasers. So I'm thinking it's radio frequency ablation. Those are things that patients can get in the US and not have to go to other countries to get. So again, it's really interesting to see the differences in standard of care. And I've seen that on Instagram and on Twitter with, the people that I follow who are in other countries, and they need a certain drug for secondary breast cancer, advanced stage 4 breast cancer, and they can't get that. And I'm thinking, oh my gosh, in the States, like we have that.
It's already approved.
Yeah, it's already approved. It's really interesting and unfortunate, but he did. His oncologist was okay with him going to Germany and getting these other treatments that weren't available to him. So in a way, those are kind of alternative or complementary treatments, even though they're conventional.
Yeah. So his leaving the country, going to Germany and getting things that I suppose are considered more cutting edge, like they're a little bit more advanced. And the TACE, which is concentrating the chemotherapy directly into the liver, was available here, but it wasn't commonly used, still isn't commonly used.
Anyways, he had a 2-month wait to get approved for Avastin. And it's interesting that they would have done the Avastin after they did the other one. They're both VEGF inhibitors.
They're both inhibitors of new blood vessel development.
Right. But yeah, that whole part confused me because I'm not familiar with how, the national health system works in terms of who can get what drugs.
Yeah, it was interesting in this movie because they're in the UK, so there's parts of it that were like, "What? That's not what would happen here."
Exactly. So that was kind of a little, confusing.
Okay, let's take a little break. I want to bring up what these two people had in common, even though they were very different people.
Okay.
All right, so we're back. So one of the things I thought was interesting is somewhere along the movie, each of them said something along the lines of kind of being the one to be in charge, which is fine because we should all be in charge of our own bodies. She said, I always use my gut. And she was also doing research, or what I would put in air quotes research, because I don't think it's real research in the rigorous sense of research. She's basically looking online, getting anecdotal evidence.
And she was fine with that. She was fine. Like she was fine with anecdotal evidence over scientific research.
Yes. Which he was kind of the opposite when it came to that. He's a scientist by inclination.
Biologist, yeah. He had a biology background, yeah.
Yeah. And he said, and I did quote this one, I'm the best person to determine my care, which I completely agree with. I think each person is the best person to determine their own care. The issue was he didn't have someone kind of explaining the limits of his own ability to do that. He had no one to check. Like, okay, at this point, you've just made these assumptions and that's why this is not a good idea. Or
he had that oncologist. He had the...
Well, did you catch the oncologist is basically, I must placate every patient to a certain degree or else they won't come back.
Oh, right.
His med-onc was like, I'll humor the guy.
Yeah.
I wasn't expecting him to stop his other treatment. So what happened was his medical oncologist in the UK said, yeah, go ahead, do the German treatment. in addition to what we're doing. I'm fine with that. Even though you and I agreed that wasn't standard of care in the United States. But in any case, he was amenable to that. The problem came in when they wanted to do what he called lasers in the movie, which we think is radio frequency ablation, which is basically, I guess lasers would be...
It's basically, you got to do the finger quotes, lasers.
It's basically a radiation type that hones in on the tumor itself and does concentrate.
Zaps it.
Yeah, it concentrates the radiation to the tumor itself and can destroy them that way. Ablation means destruction. So in any case, the UK doctor was amenable to combining them, but when it came to doing the ablation therapy to the liver, the laser, the patient opted to stop the treatment that was probably having the biggest effect. And I think they did that well in the movie. They conveyed how his treatment back in the UK was working on his tumors in his bone, in his lungs, and in his liver. But much like the other patients that they talk to later who give all the credit to the natural stuff, this patient said, no, it's the German treatment where they're only putting chemo in my liver that's really having the bigger effect. He thought the German treatment was affecting all the tumors in his whole body. And with that, he's like, I'm going to stop the UK treatment. I'm going to go to Germany. I'm going to put my faith in these folks, which didn't work. And then he ended up having progression of disease everywhere because he traded in a systemic treatment, one that treats his bones and his lungs and his liver all at once, with a treatment that only treats his liver. And this is where someone should have been very vocal with him at some point and said, you realize you're getting a local treatment. It's not what caused your other ones to shrink. The systemic treatment did. You need to stay on the systemic treatment. So I feel like that was a little bit of a breakdown. He should be the best person to determine his own care. And at the same time, he needs people to check him and say, oh, that is the wrong direction. That's not going to work. He didn't have that.
And then he misrepresented his progression to the medical oncologist who was trying to get him the Avastin. And I thought it was interesting that the medical oncologist wasn't like, well, let's get a copy of those scans. Because he was like, oh, no, the scans showed that everything was fine. And based on that, they went through with trying to get the next medication. But in the States, they would image you. They would check you, oh, we need to get copies of those records. It just was a very, again, that was very confusing to me. Like, how did he just go off of what the patient said?
I didn't understand that either. It followed on the heels of the medical oncologist in the UK basically saying they create paperwork that's so long and it's encumbering. The paperwork itself makes you not want to even fight for the Avastin drug. They make it difficult on purpose, which I thought was, wow, for a medical oncologist to speak against the machine, I was kind of surprised.
And that's kind of when Grant turns towards what would be considered more, I guess, alternative type therapy. We were just on the break trying to figure out what exactly he was taking because he says one thing, but I can't find what he said he's taking. So we think it's something that blocks copper.
I think that's what he meant.
Yeah.
Because he says ammonium tetra something, and I think he uses the wrong word because I think he means ammonium tetrathiomolybdate, which we abbreviate TTM when we talk about it.
Because it's a long word.
Yeah.
And then Surinder kind of moves from her, taking all of these supplements that she's brought in, a Rife machine. She's doing hyperbaric oxygen. She's juicing and taking some sort of miracle herb. And the bottle honestly says miracle herb on it. Mm-hmm. There's no clue what's in there. And she is reading about how carrot juice cures cancer.
Mm-hmm.
And something else I had pointed out to you, watching her cut a carrot to juice it, because she was cutting with a sharp knife towards herself with the carrot in her hand.
Towards her body.
Towards her body. Yeah, the carrot was in her hand and she's cutting towards herself. And I was like, I cannot watch this. That really was, oh my gosh. So, yeah, so they're kind of shifting their treatments based on the disease progression. She starts using cannabis rectally. She takes a little capsule and she puts coconut oil and then a little drop of the cannabis oil. And then in the movie, they start explaining where cannabis is being researched, in which cancer cells, pancreatic cancer cells, or, but they're using cell cultures. They're not testing these in humans.
Yeah.
I thought the film did a really good job with clarifying things.
I agree. They presented it and I would be anticipating like, oh my God, you can't say that. And then they're like, this is why that doesn't work. Like, so they would follow it up with something that I'm like, okay, thank you for clarifying that. Yes.
Yeah. I did the same thing.
Okay. So let's talk about cannabis a little bit. We're going to do a series on it where you and I are determined.
We have to, we got to get our guests together. We got to do this because I'm very limited in what I know.
Yeah. Cause this is a big one. Well, and cannabis, let's just take it from the top. It's a plant. And like any plant, it has medicinal qualities and medicinal components in it, and it has its proper uses. And there are people on the internet who will credit cannabis or cannabis products with reversing their cancer. But let's not forget, one of the lessons in this movie was people will credit the reversal of their cancer or the lack of progression or whatever to things that maybe didn't do that. They just happen to be doing it at the same time. So I have been doing this a long time, and I lived in a township that was a very avid pot smoking town. We'll just call it that.
It was a pot forward town.
It was a pot forward. It was a good old hippie town. Let's face it. Eugene, Oregon. There's no shortage of marijuana. People take pride in their plants. I was privy to Rick Simpson oil right when it came out. So Rick Simpson oil is a kind of a famous extract of, or infamous, depending, of cannabis that is very resinous and very high in THC. It's so strong that you do the size of a grain of rice is the therapeutic amount. And
that's the amount you start with. You start with a grain of rice.
No, you get to a grain of rice. That's the goal.
Oh.
The goal is to get to a grain of rice.
Oh, because, have you seen anyone get to that goal?
Oh, I've seen chronic pot smokers do it, and even they are stupefied by that time.
It's because it's super high THC.
Yeah. I will tell you, Rick Simpson oil is a good, what we call in herbal medicine, soporific. So it puts you to sleep. You get high and then you go to sleep. So it's very good at that. I mean, in those patients who had trouble sleeping and they were, wanted to experiment with that or dedicated to it or they have faith in it, I would say, why don't you just take it in the evening, get a good night's sleep? I'm not opposed to using plants for their medicinal qualities. Now we're talking more about CBD and THC being in balance. Long story short, I've never seen a cancer regression due to cannabis in any way, shape, or form, any concentrate.
And because it is a plant, and the THC part is, from what I understand, is what has more potential to interact with drugs. I've seen it possibly be what causes an interaction with certain cancer medications. So, I mean, there was no proof that it was that, but it was something that once that was introduced, it stopped working. And it was an oral medication. And so that's the other caution, is just because it's natural doesn't mean that it's safe. And there is potential for it to interact with drugs.
Mm-hmm. Totally agree. And I want to be clear that cannabis has uses, and that could be for sleep, and it could be for anti-nausea. It could be anti-anxiety. It could even be the CBDs can be good for pain. So I don't want to discount the plant altogether. I just don't think it has anti-cancer properties as strongly or as reliably as it's portrayed.
And it does in cell cultures. But again, we've always bring up the fact that that's not how it works in humans. I went to a cannabis conference in Portland, and they talked about like the levels to affect a human. A human could not tolerate those levels if it even would work. So, but I did have patients when I was in Arizona who came from other states where at the time cannabis products were not legal except for medicinal use, I think. I had one patient with rectal cancer who did control his pain using these suppositories he got. And he was great because he didn't have to use a lot of the opioids. And so it can work as an alternative to pain medications. Again, talk with your doctors. If you have a pain management doctor, you don't want to combine something that has the potential to making you sleepy with a pharmaceutical drug that will make you sleepy. You got to make sure that there's, no cross-mogenation going on.
Mm-hmm.
Surinder did end up seeing that oncology nurse, and she actually was a great voice of reason.
Yeah.
She was somebody that I kind of wish was brought on board initially.
That's kind of my point. I think that both of them took a different trajectory, and really they both needed a voice of reason right out of the gates.
Mm-hmm.
right? They needed an integrative oncology practitioner, whatever their training is, wherever they are in the world, somebody who knows conventional care and alternative care and integrates natural, I don't know, natural medicine in general, whether it's supplements or diet or Eastern medicines or whatever, knows the landscape well enough, as broadly and as deeply as necessary, kind of is the person that they're looking for when they want to be that person themselves, each of them, when they're doing their Google stuff. But it's not possible. You can't do that in like 2 weeks, not even 2 years. I mean, you only accumulate that knowledge with a lifetime of practice and seeing thousands of patients. And here I sit. I'm not taking new patients. I'm not gunning for us to like recruit people because it sounds like I am. It's really not it. It was a disservice to their own health to not seek someone like that nurse who is a voice of reason and say, okay, I honor what you're saying, and I only want what's best for you. And what I think is best for you is to have this definitively treated with surgery. And maybe, maybe it's a UK thing as well, but she was much more gentle and less, I don't know, passionate than I would be at that moment. I would be very much disturbed at someone who's not going to get treatment in that scenario. When it goes from a P to 2 centimeters and she still says, I don't want surgery, I would just be like, the worst case scenario in this is metastatic breast cancer and eventually, dying of the disease in a not too distant future. I would actually say those words to someone. I don't mince it at that moment because it's a big deal.
And I mean, the film was edited, and so we don't know. I mean, but she was incredibly polite, incredibly gentle, which, yeah, I mean, even exploring what was so terrifying about the surgery, because Surinder's mom died when she was young of breast cancer.
Mm-hmm.
And an interesting component to the movie was exploring the whole, I guess I'll say energetic side, the whole mind-body aspect. And the movie points out that mind-body medicine, or whatever they called it in the film, has been shown to be helpful for patients who are going through cancer treatment, but it has never been shown to cure cancer.
Mm-hmm.
And she was trying to heal her family trauma in order to heal her cancer. I think going through all of that and trying to heal your family trauma is really important to all of us, whether or not we have cancer or not. Like try to put all of that in its place where it needs to be, which is out of us. But she, again, thought that would make her cancer go away.
Mm-hmm. It harkens back to Bruce Lipton's book, The Biology of Belief, and how you can change how your cells are interacting, and you can change the communication between cells by your belief systems. The issue with this is you are relying on communication between cells, but your tumor is a sociopathic, non-communicating, not so...
It's sitting there with its little tiny cell fingers and its tiny little ears going, la, 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 I'm not listening.
Exactly. It does not communicate. That's one of its characteristic traits. It doesn't communicate properly. I mean, it literally is one of its biological characteristic traits. So I do think there is some validity to some of this, but there's a time and a place where you take the cancer out and go ahead and follow your other path, which is to change your biology through your belief system. And I do think there's some validity to all of that. The problem is, that you think you can turn around a cancer, which is not a normal tissue. And I think this is a mistake that happens all the time in alternative medicine in particular. The assumption that a cancer will respond the way that normal cells do. It doesn't. It's its own thing. It has different characteristics. It is not normal tissue. It's not the normal immune system around the tissue. Much of the immune system has been co-opted by the tumor to do the tumor's bidding. And this is why, famous book, love the message in the book. Sorry to say, it's not a great read unless you're super squirrely and geeky, but The Society of Cells, which was written back in 1999, Cancers as a Society of Cells, and we'll link to that in the show notes. That's basically it. And when I read that, I'm like, oh, if it's a Society of Cells, then it's definitely the mafia.
I just had this image of them sitting outside of like the social club where I used to like live near in Brooklyn, and like, just sitting there like with their cigars, like,
Well, and it is. It's so much like the mafia because, they're loosely related. It's not even they're not clones. Cancer cells are not a bunch of clones of each other. They're related. They're heterogeneous, we say. So they look slightly different, but they're clearly related. They're clearly one tumor, but they're slightly different. You got your cousins, your brothers, your nephews, and then nearby is the immune system, which would be the police if you were in a neighborhood. And those police are supposed to keep them in check, but in fact, they're protecting them. They're part of the mafia.
Oh, because they're in the pocket. So what we need is someone who's listening to be an animator.
There we go.
And animate that, because that's pretty cool. Often there are patients who talk about, well, so-and-so cured their cancer using diet. And we talk a lot about diet for risk reduction, and also just if you are going through treatment, what you bring into your body, that's what builds your blood cells. It's what builds your, white and red blood cells. So diet is incredibly important as one is going through treatment. But is that directly going to kill your cancer? Creating the alkaline environment or whatever it is that people are trying to achieve. And there was somebody in the movie who says that it does, and you wanted to talk about it. I'm going to put it on you. Because I now teach patients about, we're talking about Chris Wark, and he's the Chris Beats Cancer guy, and how he portrays himself and his story are very different.
And I'm going to admit, until I saw this movie, I thought he might have been an upstanding guy who was misunderstood out there. But he's talking himself in the movie. He's saying, oh, I don't think I'm misleading people by telling them they can reverse their cancer with diet, because whatever hundreds of thousands of people die of cancer every year, and they're doing conventional medicine and they're still dying. So what I'm saying isn't harmful. But he is misrepresenting himself every time he talks, because he lets people think he reversed his cancer with diet. And he had surgery to remove his colorectal cancer, which he calls stage 3. Now, I am going to do this. I'm going to get on Google. I'm going to go to the Google Wayback Machine, because my memory and my recall is that it was stage 2.
Oh, see, I seem to recall that it was stage 3. And then he said, oh, no, surgery is not something you get for stage 3 cancer. You get it only for stage 1 or 2.
Here's the thing. Cancer stage 2 and 3, for colorectal cancer specifically, is a shady little area. In other words, you can have it called stage 3, and that's just due to the size of the tumor. And stage 2 and 3 have undergone some changes in the last 10 or 15 years. The classification has changed over time. Long story short, I remember, because I looked at it in real time pretty contemporaneously when he came out with this. And I was like, what's his deal? And how do you do this? Because that's what I do. If I find people saying that they reversed their cancer, I'm like, what'd you do? What'd you do? So I track these people down. And contemporaneously, I looked online, I looked at his story, and I was like, at that time, with surgery, he had a 50-50 chance of recurring without chemotherapy. And chemotherapy just changed his odds to a betterment. It changed it to, so he'd have a 70-30 or 80-20 or whatever it was. But he had a 50-50 chance with surgery alone of never recurring. I remember that very well, because I was like, dude, he's totally misrepresenting himself. But he did put a story online. So I thought, well, maybe he doesn't mean to be misrepresenting himself. Maybe people are just taking that information and running with it. And he doesn't have anything to do with it. But in this movie, he stood there and said, no, telling people they can cure their cancer with nutrition and diet is perfectly ethical.
Yeah.
It's not. That's not a quote, by the way. That's me summarizing what he was saying. Unethical.
Yeah, no, that whole part that they actually interviewed him, it wasn't just them filming him speaking. Yeah, that was pretty
damning.
That got a lot of yells at the television, let me just say.
Well, that's because you and I know the consequences of that, and the consequences of going from stage 1 to stage 4. That's a very different life after that. And you don't mess around. You do something that's curative. And what you need to know, every person who's diagnosed with cancer needs to get staged properly. Get your scans, get the imaging done, make sure you know that you're stage 1 or 2 or 3, whatever it is, and ask your doctor, what's the potential that this cancer won't come back? If there is potential it won't come back, you need to do the treatment, right? You need to do the definitive treatment. And sometimes it's a small window. I think of people with some of the gynecological cancers, and they might have stage 2 or 3 before it's diagnosed. And there might be a very small window of opportunity between that moment of diagnosis and it going to stage 4. And you have a small opportunity to actually get rid of your cancer completely with an intensive treatment. And I would say integrative oncology is your best bet to get through it smoothly and successfully. That needs to be said. It needs to be put up front and say, okay, listen, this is your window. After this, you don't get another opportunity. I mean, even if it's a 20% chance or a 10% chance, if that's your chance at that moment, it's better than zero, which it can be in some scenarios if it goes far enough.
And, defining the definitive treatment, that's the treatment that is going to get rid of the cancer. And then, as we discussed in another episode, there's neoadjuvant treatment, which is typically given to shrink the tumor. So neoadjuvant chemotherapy for either breast cancer or ovarian cancer to try to get rid of as much disease as you can. Then you go in for your surgery, which is truly the treatment that the goal is to get rid of the cancer. And then sometimes patients will get, the post-surgical treatment, the adjuvant treatment.
And I think of it this way. They've got stats on all the conventional treatments, right? So you've got these statistics that say, okay, 20% chance, 60% chance you're going to have a recurrence. Whatever it is, I see that statistic as the worst case scenario. And the person sitting in front of me who's doing integrative oncology, who's doing naturopathic medicine alongside their conventional treatment, I'm like, well, if 60% is your worst case scenario, that's, what we're shooting for is 70, 80, 90%, right? We're hoping that we're bettering that. So whatever they're saying is standard of care. We're assuming those people who were in the studies were not allowed to do anything but the study, which was the conventional medicine. To me, that's worst case scenario statistics right there.
There are those calculators online that oncologists can look at and say, this is your benefit of receiving treatment A. This is your benefit of receiving treatment A plus B. This is the survival benefit. And for all of us who have been diagnosed, our oncologists have talked to us about that. What is the benefit of me going on an anti-hormone treatment when I'm done with chemotherapy? What was the survival benefit of getting the chemotherapy on top of the surgery? That kind of thing. Those are conversations that should be had with your oncologist.
Yeah. And that leads into a whole lesson and something I have to repeat at least 5 different ways, because there's at least 5 different ways of understanding it. And that is relative risk reduction versus absolute risk reduction. I've spoken on this topic. I've even spoken with professionals, and it can be very confusing when you're looking at the information. But it's important to understand the difference between relative and absolute benefit of any given treatment. I don't care if it's a statin drug for cholesterol. Knowing the difference and making an educated decision for yourself based on that is important. So I'm gonna have to do some YouTube videos or something that needs visuals.
Yes, it does. You do need to do some YouTube videos. We got to get our YouTube channel up and running.
Yeah, it's there. It's got some of your nice shorts on it.
Yeah, but that's not good enough. No,
I agree. I agree.
So, was there anything else you wanted to add about the movie? Did you cry, Tina? Did you cry at any point?
The only point that I probably shed a tear is when the couple had their moments.
They were such a beautiful couple. They loved each other so much. And the things that they said, like to each other, about each other, it was just so beautiful.
Yeah, because, the writing's on the wall, and you just by looking at the gentleman that he's progressing, and they're telling you he's progressing, and they've got to deal with this. And they kept the cameras rolling in some pretty intimate moments.
Yeah.
So, yeah, that choked me up.
Yeah, that got me. And then, you think the movie ends and then it goes a little farther. And when it goes to that next part, I definitely shed tears. I mean, this wasn't like a boohoo bawling kind of a movie, but it was like, just.
I'm going to give a spoiler, and if some people don't want to hear it, they can hit this fast forward button. Ready?
Okay.
They both succumb to their disease in the end. Okay. Did you fast forward? Are you back? Okay.
Spoiler.
No, the only other thing I wanted to mention before we're done is the Rife machine has been around a long time. The Rife machine is this machine that puts out electromagnetic or energy waves that are supposed to influence your entire body and be anti-cancer. And the easiest way to understand this is to picture what is a sine wave, an up and down wave, and it kind of cancels it by doing a counter sine wave. All right. Someday, mark my words, Maybe not in my lifetime, but we probably will harness energetic medicine to treat cancer. I mean, we're doing it. We're scratching the surface. We've got this product called Optune for glioblastomas. So it's a kind of a cap that people wear that gives off electromagnetic energy. So we're scratching the surface. We're getting there, but maybe not in our lifetimes, but maybe someday we will actually be able to treat some cancers with physics instead of chemistry, is how I think of it, right? Right now we use a lot of chemistry. We use drugs, we use compounds. What they're using when they use this Optune is more akin to physics, but maybe someday there'll be something that works like the Rife machine is supposed to work.
Alleges to work as, yeah. Anyway, so yeah, we're going to pick up on the next couple episodes on alternative and complementary treatments. And if you like this episode, write a review, leave a rating, send us an email if you have questions, thecancerpod@gmail.com. We'll read your question on the air. I don't have any questions. I haven't checked I'm really bad at checking email. I didn't check our email to see if we had any questions this week.
Yeah, reach out to us via email. Pass us on to friends or family that you think might be interested in the topic. And if you do have someone that you think is doing themselves a disservice by not getting conventional medicine, well, in that scenario, this movie is worth it, The Cancer Conflict. Otherwise, I don't know if it's worth much if you are already of our mindset. But if you do want to watch the movie and be convinced yourself, and I don't think they were out to convince anyone. I think they tracked these people in real time. It wasn't retrospective. They wanted to really know how this is going to go, as far as I could tell. So, yeah, I would recommend it for those folks who might be doing themselves a disservice by going all alternative. Again, I can't recommend enough finding someone to help co-pilot the decision-making with you, whoever that is, an integrative cancer person of some kind that's well-versed.
And not somebody who is trying to sell a product or an agenda, making sure that it is somebody who has a medical background. And I mean, that's not even going to guarantee you're going to get somebody who's supportive. So I don't know. I don't know if there's a network out there of people who are cancer doulas or coaches or whatever the word is that we're looking for. But yeah, if the person is selling something, that would not be the person, whether it's a service like thermography or a supplement or whatever, that might not be the person that you want to be your voice of reason.
Mm-hmm. All right.
So on that note, I'm Dr. Leah Sherman.
And I'm Dr. Tina Kaiser.
And this is The Cancer Pod.
Until next time.
Thanks for listening to The Cancer Pod. Remember to subscribe, review, and rate us wherever you get your podcasts. Follow us on social media for updates. And as always, this is not medical advice. These are our opinions. Talk to your doctor before changing anything related to your treatment plan. The Cancer Pod is hosted by me, Dr. Leah Sherman, and by Dr. Tina Kaiser. Music is by Kevin MacLeod. See you next time. Oh my God, what a piece of shit. You can put that in there. What a holy Okay, don't put that in there.